Hi, and welcome to Wow Talk. I'm Donna Capacity, a thriving cancer survivor.
And I'm her naturopathic doctor, Darlene Gustin. We're here to encourage, educate, and empower you on your journey to optimum wellness.
Welcome. What are we going to talk about today, Dr. Gustin?
Well, let's talk about leaky gut.
Oh my God, what is that?
Well, it's
sounds scary.
It's not leaky human.
Okay.
So there's a growing number of patients that are complaining of different varieties of gut dysfunction, irritable bowel syndrome, leaky gut syndrome. So leaky gut syndrome is a terminology that I think stemmed out of the naturopathic field. And the definition of that is when the lining of the gut has been damaged by something and that seal has been broken, and the bacteria and toxins and things that should not enter the bloodstream and the lymphatic system are leaking into the body instead of passing through the body. And when that seal is broken, it's a two-way street, so you could be losing nutrients. And it's something that we now have different medical tests for in the private labs. And I see it less often than people think. So a lot of patients will come in and they've heard the word, they go, oh, I think I have leaky gut syndrome. And then I might find that, well, it's not quite that bad yet, but you do have digestive dysfunction. So it's something that can lead to a lot of other conditions, that when you have this intestinal damage and inflammation, it's often behind the scenes as what happened first, and after that you got an autoimmune disease.
Oh, wow. Okay, so let's go back. You mentioned seal. What do you mean by that?
Just the integrity of the lining, like having a good fence between you and your neighbor. And so if there's a few planks missing, there's like this peak hole between your backyard and the neighbor's backyard. And so you can have birds and mice going from your house to the neighbor or vice versa. And so if you can imagine, on one side of that fence is the digestive tract, the tunnel, and on the other side of that is your actual physical body. Because if you think of the human body, all the way from the mouth through the stomach, the small and large intestine, it's this one convoluted tunnel that goes down the center of the body. And so with leaky gut syndrome, mostly we're talking about the small intestine. And the other thing too, when we talk about this, is I say it's not just about healing the gut. You also have to get rid of what's hurting the gut in the first place.
Okay, yes. So what are those things? What do we do? What do we do?
Exactly. Yeah. So two main answers is what damages the gut in the first place usually is what naturopaths call parasites. So silent, unresolved, low-grade infections. And the second thing would be food sensitivities. But of course, it could also be injury. It could be if you had radiation to your abdomen. So different things. But for the most part in my practice, it's parasites or food sensitivities. And if that goes unresolved for a longer period of time, it'll cause inflammation of the intestinal wall, followed by damage to the intestinal wall, leaky gut syndrome, followed by more and more irritable bowel syndrome, autoimmune disease, etc. So the way I diagnose leaky gut is usually pretty simple. Like if I've tested their nutritional levels, and sometimes it'll be like a gap between meeting a person who's eating really well, eating a lot of nutritious foods, yet when we test them, we find that they're missing all the nutrients despite consuming them. So then the missing gap is you didn't absorb them.
Okay, yeah.
Right. And then there are some urine tests and stool tests that do represent leaky gut syndrome. How damaged is the gut? Different chemicals are formed that should not be there, that we can detect if there's that level of damage to the gut wall. And everybody's into probiotics these days, right?
Yeah. But what would be a symptom? Why would someone think they have leaky gut syndrome?
It could be a person who's not gaining weight. Let's say someone who's recovering from some other illness and they're eating well and just not gaining weight. It could be someone who is also obese And so even leaky gut syndrome can be this abnormal usage of nutrients, and then the person systemically is inflamed, and then because of that they cling to the fat and the water in the body.
Oh,
and
okay.
and it could be someone with digestive problems, so they don't feel well shortly after eating even a healthy meal. They have a lot of bloating, they have a lot of gas, their stools look abnormal or come too often, don't come often enough. So the symptom range is very wide.
Mm-hmm.
And a lot of patients are self-prescribing probiotics these days.
Oh my.
And
Oh no.
patients think probiotics fix everything. And then I explain it to them in more simple terms. I go, if the lining is inflamed, the probiotics cannot adhere, right? It's
Okay.
like trying to plant grass on your driveway. It's not going to work. And I'm very focused on treating patients in a specific sequence.
Okay. Could you explain that sequence to us?
Sure. So the first thing is get rid of what's hurting the gut in the first place. So it might be testing and avoiding certain food allergens, gluten being a very popular guilty food.
Yeah.
Gluten, dairy, and eggs are the three most common food sensitivities that we find. And when you eat those foods, they could be causing gut inflammation. And also testing and treating parasites, candida overgrowth, bacteria, intestinal worms. And these things happen more than patients realize. It seems to be a gap in traditional medicine, that historically in medicine, doctors would deworm patients just because they saw them. They wouldn't test, they wouldn't ask, they would just treat. And so because it's an area that is underdiagnosed with medical doctors, it ends up in a naturopath's office. So eating cleaner, disinfecting the gut, killing the parasites, and then you can heal the lining. So the first thing you did is you got rid of what was hurting the lining, and then you can heal the lining, and then you can take the probiotics.
Okay. So how long does this treatment take? Is it months? Is it weeks?
If the person is to the point of having leaky gut syndrome genuinely, which comes with malabsorption and then reduced nutrient status, realistically, it's going to take several months. And also sometimes when I find parasites, I go step one alone could be 2 to 3 months of killing more than just one generation of parasites.
Oh,
So it depends how bad it got by the time I met them. But even though the full treatment plan can take 3 to 6 months, that doesn't mean it takes that long for the patient to feel more energy or better digestive function. Usually the symptom relief is within a few weeks, but to complete the treatment plan could take several months.
okay. And so does that, back to that seal, does it mend?
Of course.
Oh, it does. Okay.
Yeah. So it can be repaired. There's various supplements that are studied and known to heal those gaps in the intestinal wall that are very effective, and some are herbal as well, and those are taken before you would take probiotics.
Okay. All right. Is there anything else we should know about the syndrome?
Just the way a naturopath does a physical exam says a lot too. So you don't always have to have these fancy, expensive tests in private labs. A lot of the time, just listening for the absence of bowel sounds, very reduced bowel sounds when we listen under stethoscope. And sometimes when I feel the abdomen, if you gently feel your own abdomen, sometimes you'll see like a warmth around the belly button or cold underneath the belly button. So you'll find hot and cold spots, and that starts giving us some clues that there's chronic or acute intestinal inflammation. And also when I was in school, we learned a little bit of iridology.
Yes.
And they don't teach it anymore in the naturopathic program, but
No?
I learned a few good chunks of information. And when I look at the eyes, there's a mark that I can see on the eye that will be there, that if the patient has had long-standing intestinal inflammation prior to me meeting them, I go, oh, this has been going on for a while, right?
Okay. Very interesting. I took a course in that once.
Yeah.
But I don't remember anything really.
Yeah.
But okay, very interesting.
Yeah, so it doesn't usually come overnight. It usually happened over a longer period of time. But of course, an injury or, a series of radiations, which are done frequently in a short period of time, that too can quickly cause inflammation. But it's not like your nutritional status is going to nosedive in 30 days. But that could be how it starts with radiation damage or surgery, of course, scar tissue.
Sure. All of the above.
Yeah. At any age, too. So age is irrelevant.
Okay. Yeah, that is a really good point.
Yeah.
All right, then. I guess we should talk about those probiotics, perhaps. We could do that in our next episode.
And autoimmune disease, because what patients don't realize is your quality of your microbiome, the bug collection that's supposed to live on the lining, defines 80% of your immune system.
Oh my goodness.
So leaky gut syndrome is one potential precursor to having autoimmune disease, because it dramatically affects your immune function when your gut is dysfunctioning like this.
Wow.
So there's our next topic.
That's right. Oh my
Autoimmunity.
goodness. Oh my goodness. Yeah.
Yeah.
I feel like I'm somewhat of an expert in that, or at least having the symptoms. Anyway, well, thank you very much. This is really, really fascinating stuff.
My pleasure. I like to keep it simple.
Yes, very simple. Not too simple, but anyway, thank you very much again. And thank you all for listening.
And feel free to reach out and give us any topic suggestions. We're open to that.
Yes, we are. And you can see our email at the bottom of the description.
Thank you.
Okay, bye.